Today, I am delighted to be joined by Dr. Steve Orma. Steve is a licensed clinical psychologist and a specialist in the treatment of insomnia, anxiety, and stress. If you are a physician or a therapist who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel to join the community and keep learning about sleep. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And a quick note for doctors before we jump into the video. You're invited to get my free mini sleep course for outpatient doctors. It's filled with lots of practical tips to use in your clinical practice with your patients. You can get that at intrabalance.com/doctors, and I'll put the link in the video description as well if you want to check it out. All right. Well, Dr. Orma, thank you so much for being here today. And maybe we can start by just having you share a little bit about your background and what you do.
Yeah, absolutely. Thanks for having me here, Nishi. This is great. So I'm a clinical psychologist, and I have been a psychologist for 18 years, mostly in private practice during that time. And I started off mainly specializing in anxiety and stress, and work with a lot of other issues as well, depression, relationship issues, things like that. Until in 2014, I developed insomnia, which we could talk about, but and then that became another specialty, or the main specialty in my practice. So mainly I've been working in my training. I worked at a lot of different sites, San Francisco VA, and a lot of different types of training. But ultimately, I work in private practice. I specialize in seeing adults 18 and older, primarily for insomnia.
Right. It's so interesting to hear, I hear this from a lot of physicians and therapists who specialize in sleep is oftentimes they've had their own experiences with sleep in some form or another. And for myself, I've spoken on this channel about some of my struggles with hypersomnia and excessive sleepiness, and that was one of the things that got me interested in pursuing sleep as a career. So I'd love to hear more about your personal experiences with insomnia and how you tie those into the work that you do with your patients.
Yeah. So in 2014, early 2014, I developed insomnia. I didn't understand why at that point, or how it worked, but I had insomnia for like 6 months before I did something with it. And I had both onset and maintenance insomnia, which is difficulty falling asleep and staying asleep. And I was averaging maybe like 4.5 hours of sleep a night most days of the week. So it was pretty intense. I had some sleepless nights where I had to see like 12 individual therapy clients the next day. And that was, that was really intense. But I did get through the day, which is, an important thing to know about insomnia is you can still, you don't feel great after that, but you can function. So basically, I didn't receive any training in sleep, you talk about a lot, on your channel here and in your work. Psychologist, I didn't get one single class, not even one mention of sleep in 6 years of graduate training. The only training I got was, when I was at the San Francisco VA, they gave me a little one-page handout for sleep hygiene for veterans with PTSD, that were having trouble sleeping. Here, do these things. And that was it. And so it was ridiculous. So I had to research on my own and just like read a bunch of books and just researched. And I was already a specialist in cognitive behavioral therapy, or CBT, because I use that for anxiety and a lot of other issues. So I knew it was a very effective treatment. It's an evidence-based treatment. And then so I found this CBTI, which is cognitive behavioral therapy for insomnia, which is the gold standard treatment for insomnia. And I basically just put myself through the treatment. I didn't do it with anyone else. But I was extremely committed, and it was, it can be a challenging treatment. It took me 10 weeks fully and I got completely past the insomnia after 10 weeks. And that was 10 years ago. I haven't had a relapse since, because you learn relapse prevention at the last part of CBTI. So it really teaches you a lot about sleep and how to maintain really healthy sleep. And actually, it gets better and better over time if you maintain the principles.
That's so helpful. Thank you for sharing your background. And I think it's really powerful when you've had your own experiences with insomnia and you're supporting patients who are struggling with it because it feels horrible, right? Like,
Yeah,
and you get, if, like you said, most psychologists, psychiatrists, therapists, other physicians are not trained in sleep. They're just trained in sleep hygiene. And so you give your patient a sleep hygiene handout and they're like so frustrated by that because they've usually tried all of those things already and it hasn't worked.
exactly. And I've seen hundreds of people when they come to me, because a lot of times people don't find CBTI straight away, which I'm sure you found because a lot of doctors, providers don't know about the treatment, even though it's the gold standard, but because they're not getting that training in sleep, they don't even know about this treatment. So they'll usually go through all these. I mean, I've seen clients that have, you name it, they've done everything under the sun, medication, supplements, diet changes, sleep hygiene. I had one client who had struggled with it for 5 years. She'd been on every medication you could think of, and she was like considering an exorcism, like literally an exorcism, because she was desperate about wanting to solve the problem. And then luckily she found CBTI, she found my program. And so I think that it's a really powerful treatment. And what was the original? I think I lost track of your original question here.
Oh yeah, no, I was just talking about, how people get frustrated when they're recommended sleep
Yeah.
hygiene by their clinician, but they've tried so many things that haven't worked.
Yeah, and exactly. So they come to you trying all these things and they're really at the end of their rope. And the problem with all those treatments like the sleep hygiene and medication is they might work a little bit or they might work temporarily, but they don't sustain because they don't address the root cause of insomnia. And then the person just gets more and more worried and anxious. It kind of feeds it. There's a whole cycle with insomnia of anxiety and worry and frustration that when they try something and it doesn't work, then they get more worried and they start to develop what are called negative sleep thoughts like, oh, I'm never going to get over this. I've lost my ability to sleep, that kind of stuff.
Could you explain the difference between CBT and CBTI? Because I see these two terms often getting mixed up, especially with other clinicians who maybe aren't trained in CBTI or haven't had much education in sleep, which is not their fault. It's just this is how the training system is set up. So, what is the difference between CBT and CBTI?
Great question. CBT or cognitive behavioral therapy it's a very large umbrella of treatments that's used for almost everything, mental health related, anxiety, depression, PTSD, etc. Cognitive just means you're working with a person's thoughts, negative thinking, behavioral, you're changing behaviors. CBTI is a specific, structured treatment specifically developed for insomnia. So it's only used for insomnia. It's not really like therapy, like talk therapy, where you're talking back and forth. It's really like each session is a class, and in each session you're learning about sleep, like important things that you need to know about sleep. You're learning like myths that just are not true, and that helps manage the anxiety. You're learning what causes the insomnia, and then you're learning really key, powerful skills, mainly around changing behaviors. So it's really like 90% of behavioral treatment, where you're changing your actual sleep behaviors, how you're going about sleeping each night, and there is that aspect that does affect or address the thoughts, the negative sleep thoughts as well. But the difference is CBT is the whole umbrella of cognitive behavioral therapy. CBTI is a specific treatment only used. It's a structured treatment only used for and developed for insomnia, and primarily chronic insomnia, though I've seen it work also with acute insomnia, which is just shorter term insomnia.
That's super helpful to make that distinction. And so, for any physicians and health practitioners who are listening, at what point should they recommend CBTI to their patients?
I think as soon as they know the person has insomnia, I mean, the best way, I guess, is just they meet the diagnostic criteria. That, the patient or client is having difficulty falling asleep, staying asleep, or both, at least a few nights a week, like 3 nights, I think is the criteria at least. And that's been going on at least for a period of time, a few weeks. It's acute insomnia if it's under 3 months. If it's 3 months or longer, it's considered chronic. These are just sort of the guidelines of that. It's also affecting their daytime functioning. So things like that. And there's a lot of worry around the sleep. They have what's called sleep anxiety, and that feeds into the whole cycle. So as soon as they meet the criteria, in my opinion, they should be referred for CBTI, even if there's other things going on, like even if there's a clear trigger that caused it, or I don't believe the trigger actually causes insomnia. It causes poor sleep, and a zillion things can cause poor sleep. Even like positive things could cause poor sleep. If you're excited about something, you're going on a trip, but it's the way the person responds to the poor sleep. Right? Oh my God, this isn't good. And they get worried about their sleep. Then they start making changes to it. And then that makes the sleep worse unknowingly. They're doing it unknowingly. And then that develops more worry and anxiety, which makes them try harder. And then it just turns into this cycle. And once it becomes insomnia, it's a separate issue that has to be really addressed. You can't solve it by just getting rid of the trigger. Most of the time, when the initial trigger goes away, the insomnia stays in place. Because it's become basically like almost like a habit in their sleep system or in their thinking that maintains it. So as soon as a doctor or a provider knows their patient or client, is experiencing that and meets that criteria, I think they should refer for CBTI.
Excellent. Yeah, I agree with that because, like you were saying, people will go down this rabbit hole of trying all of these different things that isn't actually, that aren't actually helping the problem. And CBTI is the first line gold standard treatment for chronic insomnia. But even if people have acute symptoms, like they haven't gotten to that 3-month mark yet, where it meets the criteria for chronic insomnia, CBTI can still be super helpful because it is a skills-based training that people can take with them. And what's so interesting about it too, like we're both in mental health, you're a psychologist, I'm a psychiatrist, is we know that CBTI also helps reduce symptoms of depression. So it can really help with people who have those comorbid issues with anxiety, depression, trauma, and sleep.
Yeah, it's been studied, where they've done a lot of studies with CBTI. So it's been around for actually quite a long time, like a few decades at least. It's been developed over time. And so they've done a lot of studies on it, and without even addressing these other issues like depression or anxiety, even chronic pain. There's so many different mental health and even physical kind of medical issues that get improvement. Like depression has like a 50% improvement just by going through CBTI and improving the sleep, because the sleep is so fundamental to our health. We spend a third of our life sleeping. Why? Because it's so important for recovery and all kinds of processes in the brain. And so when you get your sleep back and you're back and getting that good quality sleep, it really affects everything else that you're feeling and experiencing.
I'm so glad you mentioned the medical issues as well, because a question I get asked a lot is also about perimenopause and menopause and sleep issues and the vasomotor symptoms that impact sleep. And studies have even shown that CBTI reduces vasomotor symptoms in during menopause, which is really interesting, right? Because often we're thinking of like using hormones and things like that, which are also, very helpful tool to have in the toolbox. But yeah, it's just so fascinating to see how CBTI affects so many other systems in such a positive way.
Yeah, it just shows that, the importance of sleep, and I think sleep sometimes it's getting more attention lately, I think in the last several years, how important it is. But that it's kind of overlooked sometimes, particularly in the mental health field and definitely in the medical field, as because of the lack of training. It's just amazing to me, considering how fundamental sleep is to our health. So then when you get good sleep, it affects, everything, every system in the body, I think, because you get that recovery in the brain and all these different systems in the body when you are getting good sleep, and when you're not, you know, it's going to impact. I don't think it's like immediately you're going to develop health problems, because I think that creates anxiety. That's a worry that people have. So I don't think you should worry about that, but just to know it is important, and there is a treatment that can be very effective for it.
And as you were saying, with CBTI, it's very structured. They are like classes, each session is like its own class. And so I think that lends itself well to online delivery. So maybe if you could share a bit more about, for the clinicians who are listening, how they can find a CBTI program for their patients, because that's one thing I hear is they're like, I don't know where to send my patients, or like I can't get them in to see someone, like they have a 6-month wait list at Kaiser, this kind of stuff. So maybe could you speak about like one-on-one delivery of CBTI versus group versus online, and then share more about your program and what makes your offering unique?
Sure. Yeah, unfortunately, as you are alluding to, there's even though this is the gold standard treatment, there's a great shortage of providers, and particularly providers that are experienced in implementing it, because there are people that do it, but they sometimes don't do it where they're personalizing it to the patient in terms of like their sleep schedule, like their what times they're going to bed and waking up, and things like that. But there's just some areas that don't have providers, or if they do, like you said, there's long wait lists. Could be months long. So yeah, but in terms of the different types, yeah, so you could do it one-on-one. So you could meet with someone one-on-one. I did it that way for a few years because that was a good way to really learn the treatment well. And you could either go to a therapist's office and do that, and that generally would be one session a week, probably for about 60 minutes. Sometimes it might be a little longer than that, but about 60 minutes. And at each session, it's like a class, as I was saying. So you're going to learn some education about sleep, and then you're going to learn one or two key skills that then you're going to go apply to your sleep. So the first week, you're going to learn how to create a sleep log, because we need that to track a certain data, because that's important to personalize it. And you're going to learn to start shifting the negative thoughts, for example. And then you go and you implement that. And then you come back in week 2, you learn a couple new skills. And then that's layered. And so if you're doing one-on-one, you're going to meet generally once a week. Sometimes there's a break between, weeks 4 and week 6 where you don't meet for 2 weeks. And you're usually on your own when you do one-on-one in between the sessions. So you're kind of given, this is your homework for the next week. And then you go and you do it, and then you come back and meet with the therapist, and you can talk about what happened and questions and all that kind of stuff. That's one-on-one. Then you could do online. You could do it online. Now, so my program is online. I'll talk about that in a minute, and I'll explain why I created that. I don't know of a lot of complete online programs. There's a program called Shut Eye that I'm aware of that's been around a while, but I'm not sure. I haven't gone through that program. And there's others, but I don't know all the different online programs. But you could like do a search on Google and see what's out there. There are apps too. There's a lot of CBTI apps. The one thing you want to be, so it just really depends on what the person's looking for in terms of a fit. Some people want to meet someone in person, and some people want the convenience and the accessibility of the online. And the thing about the apps is you're normally not getting any kind of support because it's an app. So unless it's built into the app, you're not getting that, or sometimes it lacks the personalization, which is really important because it needs to fit. It's a structured treatment, but it needs to fit your sleep pattern on a week-to-week basis. You're adjusting. It's dynamic. So in terms of my program, it's an online program. So I did it for probably like 3 years one-on-one, and I really learned a lot doing that. But what I found is, because each session is pretty much the same for every client, it's structured, it's a class, or certain information you're communicating, and then there's skills, and the skills are all the same for everybody. What personalizes it is the data that you get in the sleep log each week. And specifically, I don't want data to sound like, kind of intimidating. You're just basically getting up each morning, recording what time you went to bed, what time you woke up. And then there's two key numbers that you're looking at, which is your average sleep time and your sleep efficiency. And that's how you personalize it. So I decided to do an online program during COVID, actually. And I decided to do it for a couple of reasons. Number one, because of the lack of accessibility, that, if you have a provider in your area and there's a huge wait list, then you kind of have to wait. And that's hard. I mean, people with insomnia are suffering, and they don't have to want to wait 3 months or 6 months for good treatment. So that's one thing is my program. It's an online, coaching program for insomnia, CBTI built on that. And so it's accessible from anywhere. And so that's, you can get right in without getting on a wait list. The second thing is, it's convenient for people who are busy. I have a lot of busy professionals in my program. I have, full-time moms or dads that are parenting their kids. And it's hard to they have to schedule a session to meet with a therapist or drive there. This way they can go through the trainings each week, and they could do it on their own time whenever it's convenient for them. It doesn't take that long to go through the trainings each week. And then there's no extra time beyond that, because you're just applying the skills at night with your sleep. You're not doing stuff during the day because you don't want to really focus on your sleep during the day. That's a poor sleep behavior that feeds into the anxiety. And then the other thing I'd say that makes my program unique is it's an online platform where there's a community of other people going through the program at different stages. And you're not going through it alone, because it feels very alone going through insomnia. And you don't have to participate in the community, but it's there, and you could see other people's posts and my responses, and then people post wins, and it's supportive. And so that's great. And then there's a private feature, like a private chat feature. So people have personal questions they don't want to share with anybody, and they just want to ask me something through there. They can do that. And I provide support 5 days a week. So anytime they have a question, they can send me that and I'll respond to it 5 days a week for 8 weeks. So the program includes is all that. So they get a lot more support. Instead of just meeting once a week, they're getting support when they need it, basically over the course of that week.
That's fantastic. And yeah, and I've actually seen Dr. Steve's program, and it's really great, and just such a unique blend of the educational piece and then the support and the community. And I think that, like you said, because it's so accessible, I'm curious, do you see better outcomes with your program versus when you were doing the one-on-one weekly sessions?
I think for me, I think the outcomes are about the same, and I think the outcomes for CBTI, I think one factor that I think that is not taken into account when they've done the study, it's got a very high success rate. That's why it's the gold standard, but I think it could be even higher if the patient or client coming in is committed, is really, because it's a challenge. It's a behavioral treatment, right? It's not like, you're just in talk therapy and you're talking, which does take some effort, but with this, you're learning stuff, and then you have to go apply it, and you have to do that over several weeks. And so there's a commitment factor. And what I find is the key sort of trait in the client that gets them success. And I would say nearly 100% of the time, if they have that commitment, they're going to get at least really good improvement in the sleep. And then I would say 80% or better, they're going to get complete, elimination of the insomnia. Everybody's different. Some people are coming in with, they're taking multiple medications, so that it's a little more, complex in terms of, unraveling that. But I think that commitment is really thing. So when I was seeing people one-on-one, I found the people that had the most commitment, meaning I am done with this sleep problem, and I'm ready, and it's a priority for them. And when they have that, I don't care what they have. One of my first clients was an anesthesiologist, and she was doing like shift work. She had one day a week she was on call for like 24, 48 hours, and that just messed up her sleep. And she had two young kids on top of that, and she was married. She had a very busy life. And, but she was so motivated, because if you think about the dangers, if you're not sleeping and you're doing anesthesiology, that could be very risky, right? So I think that because of her commitment, she was able to get past the insomnia. And that's what I've seen, no matter how old they are. I've all different ages, genders, people from different walks of life get insomnia. It doesn't it doesn't discern between those things. It could hit anybody, but it's that commitment to going through the process that really makes a difference.
Absolutely. And I think, yeah, and just to underscore that, one of the things that people will come away with, after they do CBTI is sleep confidence, where,
Mm.
when they're doing something that's more like external, like I'm taking a pill, I'm taking a medication, a supplement, like you were saying earlier, it reinforces the lack of confidence. Like I need this external thing to sleep versus with CBTI, it's behavioral, it's this internal process as well. And so they start to feel confident in their ability to sleep, which is such a core aspect of, gaining benefits and then maintaining, success with their sleep.
Yeah, and I love that term, sleep confidence, because it really is key. Because one of the core things that happens with insomnia is people lose their confidence and their ability to sleep, and their personal ability to sleep. There's something wrong with me. I've lost my ability to sleep. What's going on? So they think that they lack their ability to sleep, which they actually haven't. They haven't lost their ability to sleep. They're just unknowingly they're getting in the way of their sleep by doing certain things. And yeah, there might be other factors going on in their life too. So building that confidence back is key. And what undermines the confidence, as you were saying, is when they're prescribed a medication, or they're using a substance, even like CBD or something like that, which again, I'm not saying these things can have certain benefits to them, but I think the downsides are way bigger. And what happens is they develop psychological dependence outside of the physical dependence that you can get from a medication. The psychological dependence can happen with any substance they're taking, because it fosters the belief, I don't have the power within myself. I don't have the ability to sleep. I don't have that confidence in myself. So I need this external thing to just, help me. But even again, if there's some benefit, the downside is it undermines that confidence, and it keeps you in that cycle of anxiety and not trusting your ability to sleep.
Okay, so for any health practitioners, physicians, therapists, sleep coaches, what is a clinical tip that you would like to share with them that they could take away from today?
I think the message, well, I think, like maybe, well, there's a couple, but I would say that message that I just said, that when someone is experiencing insomnia, they're having that doubt about their ability to sleep. They think there's something wrong with them. They might think there's something medically wrong with them. It's scary. They don't know what's going on. Is to communicate to them, you have not lost your ability to sleep, and you can overcome this. This is not like something you're born with. Sometimes people develop kind of an identity around insomnia. If they've had it, a long time, they'll think, I'm an insomniac. They'll use that. And that's really, I know people sometimes do it even in a joking way, but it can be very damaging, because it sort of, if you're an insomniac, well, how are you going to overcome it if that's who you are, So what a doctor can do, or any kind of provider can do, is say, look, this is something you can overcome. There's this great treatment for it. It's got a very high success rate. You're not, you don't have to suffer with this. And that alone will help their mindset. Just knowing they can overcome it, and their doctor, who's going to hold a lot of authority, is telling them that, the doctor has to believe it. So hopefully, maybe watching an interview and other interviews that you do to educate doctors around this, we'll get them, believing in it, that this is very effective. But I think that communicating that to the client, or the patient is the most powerful thing they can do, because it'll just relieve them. They'll be, oh, okay, good. They'll be relieved because they lose hope. And I think that's the best thing that they can do for the patient.
Thank you for that. That's such a great tip, just helping them make that little mindset shift. That can go such a long way. And, and again, for people who are watching this and listening, Dr. Steve is one of our guest experts inside the Clinical Sleep Kit program, which is my program for clinicians to learn about sleep and to really, help you fill in the gaps, because most of us don't get any training in sleep, or very limited training in sleep medicine during medical school, residency, or, graduate school if you're a psychologist. So Dr. Steve is going to be our live guest expert for our live Q&A in August of 2024. So for any of you who are interested in learning more, you can come and join the program. I'm opening doors in June 2024. So, so Steve, how can people find out more about you? Could you share maybe your website? I know you have a YouTube channel, how they can find your program. And if people want to connect with you, what's the best way to do that?
Sure. Yeah. I think my website is a good place to go, which is just drorma.com, DRORM is in Mary, A.com. And if they go there, if you're someone with insomnia and you want to learn more about CBTI, you just click on the navigation on the top. It says insomnia program, and I kind of go into CBTI in detail, and there's an FAQ, and then there's a way to enroll if you want to enroll in the program. If you're a provider, if you're a doctor or a therapist or a clinician and you want to refer a patient, I also have a tab, refer a patient, and there's a referral form that you can fill out for your patient that I'll receive. And then I'll reach out personally to your patient, and and connect with them, and kind of see where they want to go, or if they have questions they want me to answer. And I also have a YouTube channel, which is called Put Insomnia to Bed. I have several videos on there where I talk about insomnia and different aspects of it as well.
Excellent. So I'll put all of those links in the video description underneath. So you can all go ahead and check out Dr. Orma's website, his YouTube channel, his program. But thanks so much, Steve, for being here today. This was, I think, a great conversation, so helpful. And I think clinicians will come away with a lot of really good, useful information that they can start to implement with their patients.
Thanks, Nishi. Thanks for inviting me on and giving me the opportunity to, talk about this stuff, because I think it's so important. I think what you're doing with your Sleep Kit community and your YouTube channel here is awesome, because it's so needed in the mental health and the medical field, for people to know more about sleep.
Well, thanks so much. All right. Okay, I'm going to stop recording.